Kansas City's breaking news leader. This is complete coverage. This is NBC Action News Today.
All right, thanks, Darren. Hey, in today's health, we're focusing on reconstructive surgery after breast cancer. We have plastic surgeon Dr. Brad Storm who's joining us today. We're going to talk about just the basics that women have to go through, and this is a segment that actually could take a full hour to have a discussion on, simply because there's so much variety when it comes to it. But let's kind of talk about when it comes down to a woman's been diagnosed. A mastectomy is most likely going to be her best option for survival, and so she's already had that conversation. In the midst of that, they bring up, you should make a decision before we even remove your breast on whether or not you want reconstructive surgery. How much information is a woman need to be asking questions about before she even makes a decision on that?
Well, it's a tough time because they've gotten their diagnosis. They're thinking about chemotherapy, radiation, surgery, a lot of decisions to make. So we try to keep it as simple as possible. And the first decision is, do I do it or not? Most women, of course, don't. The other question is, do I have the reconstruction at the same time as the mastectomy? Or do I get my treatment, let things heal, and then go back in at a later date? And depends on the patient. Some options are better for some patients than others, but oftentimes they have two choices.
Do most women sit down with their oncologist and a plastic surgeon in the same room and have the discussion? Or is she sent to the oncologist first and then she goes to a plastic surgeon, you know, second? Are you guys ever in the same room at the same time as doctors?
No, they basically make the rounds. They see radiation therapists, doctors who give chemotherapy, surgeons, and then I have a separate consult. Okay,
so we were talking about insurance, which I didn't realize. I said one of the things is just the money factor for somebody who may or may not decide about reconstructive surgery, and you gave me a piece of information that I was pretty happy about.
There's a federal mandate that requires that insurance companies cover the cost of reconstruction of the affected breast, as well as matching procedures for the opposite breast, reconstruction of the nipple and the areola. They are all required to be covered by law.
Because somebody who may be in their 20s or 30s may have a certain breast augmentation, and then in their 50s, obviously, Mother Nature takes over and gravity takes over and things change. So is that something else a woman should consider when it comes to reconstructing the one breast that may be affected?
Oftentimes, with age, patients are not really desirous of having a reconstruction that looks like their opposite side. So that's when the matching procedures come in, such as lifts or reductions or augmentations.
There are two types of reconstruction. I think most people, when they think of plastic surgery or reconstructive surgery, they automatically think an implant. There is another option for women out there.
Yes, the tram flap is the most common type of other option, and that is using the patient's own body without any kind of man-made device to reconstruct the breast with their own tissue, which comes from the lower abdomen just below the navel.
Which I thought was interesting. I had never really heard or even paid attention to something like that before.
It's really the gold standard type of reconstruction in terms of being natural, looking natural.
And feeling maybe even more a little bit like themselves.
Yes.
Doctor, thanks so much for coming in. We appreciate it. For more information, as always, talk to your doctor, but you can also call 913-782-0707. Go to NBCActionNews.com as well. And again, please talk to your own doctor. Okay, looking for a great read you can enjoy with your kids? We're talking with Jamie Lee Curtis about her latest children's books coming up.
Make sure to check out